So I'm really quite excited about this committee. It's a new committee, and the reason it was formed is because women orthopedic surgeons have made a huge impact in orthopedic surgery as a specialty overall. But in arthroplasty, we've lagged a little bit behind. We don't have quite the numbers, and we're not attracting the women that we want to in field, profession, technique, expertise, etc., into arthroplasty as a subspecialty.
The formalization of this committee has had the added benefit of new mentors, women who've been in practice 10, 15, 20 years, who've given me a lot of advice as far as how to run my practice, the structure of the practice, difficult cases, how to approach difficult cases in the institution I'm currently at, and seeing what people are doing around the country here at AAHKS.
So I will give AAHKS a lot of credit. They are at the forefront of changing how we are shaping arthroplasty surgeons. So traditionally, arthroplasty surgeons are one of the lowest when it comes to representation of women as a society, and it's lowest in the hip and the knee society. But in the entire country, only 6.5% of orthopedic surgeons are women. So it's a very low percentage. But AAHKS does have a lot of foresight, so we just created the first Women in Arthroplasty Committee.
This is a very big deal. So I'm a PhD, I'm an engineer, and I've been working in orthopedics for about 15 years. This is a group that we just had our first inaugural speaker. This group was developed about a year, 2 years ago, and there's a very small amount of women that are in orthopedics that are practicing orthopedic surgeons. It's not typically an area that many women or young girls go into. Oftentimes in residency and fellowship, it's a tough area to kind of maintain a leadership position in. So to have so many women in this room all together, being able to network, be able to build their brand, being able to talk to each other about opportunities and even challenges is a really big deal.